Thank you for your interest in this topic on physical activity and its effect in lowering the risk for acute respiratory infections. It is my belief that there is enough evidence now that there is time for scientific consensus recognition. We know that the 2018 physical activity guidelines for Americans, and we also know that the World Health Organization adopted these same principles, that basically the slogan is that people need to move more and sit less. And if they do that, there are many, many health benefits, and the goal is about 150 to 300 minutes per week. So here's the list of all of the health benefits that come when moderate to vigorous physical activity is engaged in on a regular basis. Notice that on this list, there is nothing about its effects on the immune system or its effects on lowering infection risk. Here's a summary slide of some of the more important studies in this area. Notice that studies rather consistently show that various types of infectious diseases, COVID-19, the common cold, viral bacterial diseases, pneumonia, and influenza, that if you compare the risk for physically active people versus inactive people, you have about a 54% difference in risk. Let's look at some studies that I think best portray this. This is a study of about 97,000 people in the UK. They were followed for about 9.4 years. The blue bar are those who were following the physical activity guidelines of 150 minutes per week or more. And then the gold bar were the sedentary people. And if you look at bacterial infections or viral-based infections or pneumonia, there was about a 24 to 54% reduction in the risk for mortality from those diseases. Here's another excellent study of nearly 470,000 adults followed in the UK in their biobank study during 11 years of follow-up. And they looked at different lifestyle disease risk factors and infectious disease mortality. And the healthiest tertile is the green bar. And notice for physical activity, there was about a 36% reduction in infectious disease mortality risk, sleep about a 20% reduction, diet about a 15% reduction in the healthiest tertile, and about a 63% reduction in those who avoided smoking. So notice that physical activity, the strength of that lifestyle habit was very robust, especially in comparison to diet and sleep. When all of these were put together, the healthiest people who were active and sleeping well, had a good diet, didn't smoke, we see here about a 71% reduction in risk for infectious disease mortality. Here's a study we did of 1,002 adults. We had two groups. One followed in the winter for 12 weeks, the other in the fall. And we used modeling to rank order the various demographic and lifestyle risk factors for the number of days sick with upper respiratory tract infections. And notice that older people had fewer infections. This is consistent with many other studies. But notice the second rank factor and the number one lifestyle factor was physical activity. Those who were engaged in higher levels, the upper tertile, had about a 46% reduction. Notice that even medium amounts of physical activity had a very strong effect as well. Also, notice that fruit intake, people with high fruit intake, that was another risk factor that worked very well in lowering sick days with a common cold. This study of about 48,000 patients who were diagnosed with COVID-19 in California in the Kaiser Permanente system, they divided people into low amounts of activity up to recommended amounts. That's the gold bar. And as you can see, if you look at severe outcomes for COVID-19, that people who were engaged in recommended levels of activity had a huge decrease in the odds of having a severe case of COVID-19. Here's another study out of South Africa with 65,000 people who had confirmed COVID-19. Again, the blue bar here are those following the physical activity recommendations, and you can see that there was a very strong reduction in the risk for severe COVID-19. Here's another study where they looked at the effect of body mass index and physical activity, and here we have people with low amounts of activity who were obese, and then if you compare them to non-obese, highly active people, there was a 2.85-fold difference in the odds of mortality from COVID-19. Now, here's another study of 2,690 adults in the UK Biobank study, and they actually measured aerobic fitness and they divided it into low, moderate, and high. The big finding here is mortality was strongly reduced in the fitter subjects, but notice that the risk of having a positive test did not differ significantly. So you may get infected even if you're a fit person, this study says, but you're not going to have a severe outcome. Other studies have shown this. So I think this is an excellent illustration. The gold line here shows the normal viral load response to getting infected with COVID-19. We think that if you're a lean, fit individual, that you may get infected, but the viral load will be lower because you have a robust immune response, and then you'll clear the virus more quickly and have a milder form of COVID-19. This is really what the vaccine does as well. It may not prevent the infection, but it keeps the viral load down. So we call this the vaccine-like effect of being a fit, lean, active individual. So how does physical activity work in lowering the risk for acute respiratory infections? We know that every time you are physically active, if you go for an acute bout of like a brisk walk in hilly terrain, like this subject in my lab. We know that important immune cells are recruited from the peripheral lymphoid tissues into the circulation. And then when the bout is over, within a few hours, the cells return back to the lymphoid tissues. What's important is the concept here is that exercise stimulates the exchange of important immune cells between the circulation and the tissues, and this enhances immunosurveillance against pathogens. It's like sending the military out on a regular basis to engage the enemy. And I think what's very important is some of the best fighting cells of the immune system are recruited during exercise, specific types of monocytes, and then many neutrophils, natural killer cells, immature B cells, killer T cells, and within the tissues, animal studies show enhanced activity of the macrophages. As the acute exercise is engaged in on a regular basis, there's a summation effect, and then you are clearing pathogens more efficiently from the body, and this lowers the odds of either getting infected, but more importantly, of having a severe outcome. I think this is a great study. It compares the physical activity and disease risk for various types of common diseases. The blue bar is insufficient. The gold bar is meeting the 2018 activity guidelines. So all-cause mortality is down about 40% in active people. Cardiovascular disease about 50%. Cancer down about 40%. Diabetes down about 53%. And then influenza and pneumonia about 54%. So this study, which is just excellent, a huge cohort, it just shows that we have a lot of data now that support the fact that infectious disease mortality or severe outcomes is reduced in cohorts of physically active individuals. So for these reasons, I feel it's time to add this physical activity related benefit to the list of what exercise can do, regular physical activity, what it can do for the population. We know that COVID-19, influenza, pneumonia, the common cold, these are among the most pervasive, common, and really the most bothersome diseases we have on Earth. And there's a growing awareness that inactivity is a risk factor for having more respiratory infections. The linkage here has been strengthened during the COVID-19 pandemic because now we have data from large cohorts that have been followed. The pandemic, it increased scientific scrutiny in this area. So the lowered risk for severe COVID-19 and acute respiratory infections in physically active groups. How does that happen? Primarily because we have an enhanced surveillance of key immune cells and overall inflammation is reduced. The net effect is the immune system can better cope with pathogens that come into the body and help clear them. Thank you very much. This is Dr. David Neiman. This is the North Carolina Research Campus where I have the App State Human Performance Lab. Thank you very much.